Hello, everyone, and welcome, and thank you for tuning in to Health Leaders, the place for peer-sourced and solution-focused insights for healthcare executives. My name is G. Hatfield, and I am the CNO editor for Health Leaders. Today, we are speaking with Kat Ascencio-Holmes, who is the System Chief Nursing Officer at Sutter Health, about the organization's new mobile simulation lab. So, hi, Kat, how are you?
I'm good, G. Good to be here.
Yeah, thanks for joining us. And this is a really exciting conversation that we're going to have today. So, to kind of kick us off at a higher level, what are some of the biggest hurdles that CNOs are facing when designing standardized training for nurses across a health system?
Oh, gee, one of our biggest challenges is ensuring equitable access to learning opportunities across our geographic diverse locations. And another is creating a consistency in that training while supporting the unique needs of the individual communities that we serve. The mobile simulation lab helps us address both those challenges. It's bringing a high quality simulation experience directly to care sites, and we're expanding it across all of our facilities. We're actually going to be able to reduce travel time and reinforce our evidence-based practice across our system and really do a team's approach.
Mhm. Absolutely. So tell me all about the mobile simulation lab. What was the inspiration behind it, and what are some of the bigger goals for it?
The inspiration was access. We already have an exceptional simulation center in Sacramento, in Roseville, and Modesto. But we wanted to extend those learning opportunities to more clinicians across our integrated network, as well as our nursing teams. The mobile simulation lab allows us to bring that immersive, hands-on training directly to hospitals and our clinics. And it expands access, supports our workforce development, strengthens our teamwork, and really helps standardize training experience across Sutter Health.
Absolutely. So what kind of equipment and technology are inside the unit?
Well, our simulation is a 44-foot mobile simulation lab. It's believed to be the first of its kind in California. We have 2 simulation rooms, 2 control rooms, and a dedicated debriefing space for the teams. The equipment inside, we have neonatal mannequins, we have pediatric, adult, geriatric, and even a birthing simulation. I got to witness that the other day.
That's
Training examples that we can do in the simulation is really respiratory distress for the newborn, complicated births, emergency responses, team-based exercises, and really procedural skills training. So when we think about training in a scale, we train about 4,600 clinicians annually, and we do about 4,700 today immersive simulation training. Now we'll have a mobile simulation to add to that and increase our training across Sutter Health.
Yeah, that's really cool. And I'm curious, how did you kind of like do the spatial planning for 40? Because 44 feet is not that much for 3 different spaces. So what kind of thought went into that?
Well, the great news is that we had years with simulation
Mhm.
and what we knew we needed. And then the truck kind of determined, okay, you have this much space.
Mhm.
I will tell you that it's a lot more space than you think. And being able to have the simulation and the trials and have the team together, it's actually quite roomy.
That's awesome. So what are nurses sort of able to step out to use the simulation lab? Is there time that's kind of built into their schedules, or what does that kind of look like?
Yeah, like at Sutter Health, education and professional development, they're priorities for us. And so our local leaders work closely with the teams to incorporate that training opportunities while maintaining our patient care operations. I think really one of the biggest advantages we have with mobile simulation lab is really reducing that travel time, and it makes participation more accessible because the training comes directly to them. And we're bringing that training to caregivers and instead of requiring caregivers travel for the training. So we're excited about that.
Mhm. Absolutely. And then I know this is everybody's favorite topic, but right now with everything that's kind of constricting healthcare with costs and everything, how much did it cost to launch and like execute this? Because this is pretty incredible.
Well, I'll tell you, we're really proud of the Mobile Simulations Lab that it was made possible through our philanthropic support and from our generous donors across our system. That includes our employees, our physicians, and our community supporters. What's the most important is really the impact of this investment on expanding access and training and strengthening our workforce, supporting our safe and high reliability that we have here at Sutter Health.
Mhm. Absolutely, yes. So were there any unexpected sort of hurdles in the process of making this happen?
I think with any initiative of this scale, it requires collaboration across clinical education, operations, logistics, and leadership teams. The key focus was ensuring that that mobile experience delivers the same high quality, immersive learning environment that we expect in our simulation centers. And it was also important for us to create a model that could support a diverse care setting across the system. And while there were, I would say, less hurdles, more pivots, we were very successful with it.
Hmm. I like that wording, pivots. That's good. So, do you have any advice for other CNOs or healthcare organizations that might want to try a similar approach?
Yeah, I would encourage leaders to start with the workforce needs rather than the technology. Ask how you can make learning more accessible. Let's reduce the barriers to participation and create opportunities for teams to practice together. You know, simulation is incredible. It's incredibly powerful because it builds that confidence, that teamwork, and that clinical judgment in a safe environment for our nurses.
Mhm. Absolutely. Well, thank you so much, Kat, for your time. I'm really glad to finally see you face to face and have had this opportunity to hear your insights. And thank you so much to our audience for listening. Thank you, Kat.
Thank you.